Works. Takes a moment. I'll let you know when we're actually live.
Oh, there's still, I was going to ask.
Oh, looks like we're live now.
Okay. Good morning and welcome to the Insurance and Pharmaceuticals Subcommittee of the Health and Government Operations. We are going to, let's let folks in for HB 191 will be our first bill today.
I see Lori Doyle with CBH. I don't see Lynn or Sue Ann yet, but.
Okay. Lori's here. Do we have somebody else for 191?
There's two other people, but they haven't signed in yet.
Okay.
No.
So we are going to go ahead with House Bill 191. Lisa, when you tell us what the bill does.
House Bill 191 repeals the sunset on provisions of law that require the Maryland Department of Health to include psychiatrists and psychiatric nurse practitioners providing assertive community treatment or mobile treatment services, and any regulations that specify the types of healthcare providers eligible to receive reimbursement for medicine health care services. And it repeals the sunset on provisions that specify that a healthcare service provider through telemedicine by a psychiatric or psychiatric nurse practitioner is equivalent to the same service when provided through an in-person consultation. And there were no amendments.
Okay, no amendments. And Lori, good morning. You want to speak to this bill?
Thank you, Madam Chair, and good morning to you and good morning to the subcommittee. Yes, this bill, you all passed two bills in 2018 and 2019, allowing first psychiatrists and then psychiatric nurse practitioners on ACT teams to provide their services via telehealth. And it's been a godsend. Of course, this was before the pandemic, but it's been a godsend before and after. It's a very challenging population ACT teams serve. There was no opposition to this bill. And the reason that the sunset was originally put on was a fear of fiscal impact, and the fiscal note indicates there has been none. So for the clinical reasons and the fact that there is no fiscal impact, I hope and pray that you will pass this bill. Thank you.
Thank you. Delegate Kelly, would you like to add anything?
Thank you, Madam Chairman. I will just repeat what Lori said. I think that this is going to help some people, and I would be really appreciative for the support of the committee. I don't see any concerns with this bill right now. I have only heard really positive feedback from the stakeholders, but it sounds like someone else has something to add. I heard someone pipe in, so maybe we need a more further discussion. But I will just add that my conversation with the community providers has been really positive on this.
Okay, thank you, Delegate. Delegate Krebs, do you have a question?
No, I'm just going to move the bill.
Okay, Delegate Krebs has moved a bill. Do I have a second? I have a second. Any discussion on?
Just a quick question.
Sure, Delegate.
I was just in the testimony. It looks like from the Maryland Psychiatric. Do we have an amendment?
Oh, we do not. I can answer that. We tried to address this in the hearings, but the Psychiatric Society does want to include audio only, but that doesn't need to be dealt with in this bill. This bill can move separately from that, and that can be handled in the other bill.
Great.
Yeah, we have like 3 other bills on audio.
Got it.
We're going to have that opportunity for sure. Okay, the bill has been moved and seconded. Any further discussion? Okay, those in favor of the bill, please say aye.
Aye.
Is there anyone opposed to the bill? Please raise your hand. Seeing no opposition, House Bill 191 is passed unanimously, and we will take it to the HGO committee later this week. So thank you very much.
Welcome to the 21st century.
Thank you. Yes, welcome to the 21st century. So we will turn now to House Bill 14, and we will invite folks who are here to speak on House Bill 14 in from the waiting room.
All right, so I've let in Brian Lowe and Sarah Price.
Okay. Okay, we have both of them here. Welcome, Brian and Sarah. Lisa, tell us what House Bill 14 does.
House Bill 14 specifies that for drugs and devices dispensed by a pharmacist in the manufacturer's original packaging, that the expiration date included on the label must be the expiration date set by the manufacturer, or a shorter period is determined by the pharmacist. There is an amendment in your packet that would require that the original packaging be sealed for the provisions of the bill to apply.
Okay. Del, I'm going to go to Sarah first. Sarah, you have some information and info on the bill.
Yes, so as we reviewed in the hearing, the bill would just bring the expiration dates up to date. We aren't sure when the current law came on the books. We've looked into it. We can't figure out what the reasoning was. So it's just common sense to make it so that drugs are not wasted or thrown away when they don't need to be. To that end, we've reviewed the amendment, the proposed amendment, and we actually would not be able to support adding the word sealed, because some drugs are not dispensed in that original sealed packaging. For example, inhalers, the inhaler insert is not dispensed in the sealed packaging. And they also do not typically expire just within 1 year. So adding the word sealed would cut out a swath of medications from the bill. So we would not be able to support adding that language.
Okay, thank you. Brian, you have some more information?
Yeah, thank you, and appreciate you including me in this conversation. As Sarah indicated, that this bill is really a consumer advocate bill, right? We're trying to find a way so we can limit the amount of purchases a consumer has to make, right? If their expiration date is if the manufacturer expiration date is 3 years from now, if Walgreens has to dispense today, state law requires us to put an expiration date of February 2, 2022. So there's 2 years there where that the medicine is certainly is still good. The manufacturer expiration date is still valid. So we would we support the bill wholeheartedly. As Sarah indicated, the amendatory language, I understand what the thought process is behind it, but one of the main types of medication that we're looking for to cover is an inhaler. I have an inhaler. It comes in a box and it's just sitting there in the box. It's not sealed. So while I understand where that amendment, what you're trying to do there, I get that. In this instance, we can't support the amendment. So, but happy to discuss further.
Okay. Delegate Kerr, I'm going to go to you first on the bill, and then if you would talk to us a little bit about the amendment.
Thank you, Madam Chair. The amendment came about as a result of testimony during the bill hearing. And I guess we just didn't have a chance to go back to the advocates who are here with us today to find out that may be an issue. So we went ahead with the amendment thinking that it would be acceptable to all parties. I guess perhaps we could alter the amendment to say that in the manufacturer's sealed packaging where applicable, something along those lines, to then allow for the things like the inhalers that where there is no manufacturer's sealed packaging. So maybe Lisa could offer some type of an amendment language that would accommodate everything we're trying to do here.
Are there other examples besides just inhalers?
Sorry, this is Brian. I think that there would be other types of medications similar to that. Maybe, and I would have to run this by our team. Maybe we could use manufacturer's original packaging.
That was the original language in the bill.
Understood. Okay. Yeah, I do think it would apply to some other types of medication outside of inhalers. I can confirm that, but that is the concern, that we would still be in the same position we are now, And that's where, Walgreens, like I said during testimony, has essentially been violating state law by using the manufacturer's expiration date.
So Brian, my inhaler comes in a box, which is sealed. I mean, there's a like a tape seal over it. Would that be the case with most medications? Are there medications where the box is not closed?
So the box, so the inhaler I use, it comes in a box, but it's just, the box is closed, but there is no tape on it.
There's no tape.
So I maybe some are, some aren't. I don't know exactly how that works. But so that's the concern, that there are those medications that it wouldn't apply to. And those are the ones that we're really trying to address through this legislation.
Let me ask other members of the committee if you have a sense of the need for the word sealed.
I'm sorry.
Delegate Kipke?
I would just think that if somebody were to give a product that is dangerous, their license would be on the line. I mean, there's already sort of protections against that today, and they're already giving out I think there's already protections for public safety that makes this language unnecessary. I understand that it was suggested by the Board of Health, but I would think that it would be more, if the Board of Pharmacy was asking for this, I would think that maybe we should give it a little bit more credence. But in my opinion, I feel like there's already protections against this type of thing.
Yeah, okay. Is there anyone who wants to move this amendment?
Madam Chair, I have a
sorry,
hand up.
I'm sorry, Delegate Krebs.
That's okay. I don't think it's necessary at all. I don't think it's really relevant, whether it's 1-year expiration or 3-year expiration. I'm not sure what the purpose of sealing it is, because you're doing it now anyway. So I don't think it matters. So I move the bill as originally proposed, and I think it's a great bill as it is.
Okay, so I have a move and I have a second. Delegate Bhandari seconds. Any further discussion on the bill? Seeing none, those in favor of the bill, please say aye.
Aye.
Anyone opposed, please raise your hand. Seeing no opposition, then House Bill 14 is passed unanimously and will go back to the committee. Thank you very much, Brian and Sarah, for being with us today. We are moving to House Bill 34. And so I would ask that the folks who are here to address House Bill 34 be allowed in from the waiting room. Okay. Okay, do we have everyone, AJ?
We have everyone that's requested to join, yes.
Okay, great. Thank you. So we're here now to discuss House Bill 34. Lisa, tell us about the bill and what it does.
House Bill 34 is an emergency bill that requires the Maryland State Department of Education and the Maryland Department of Health to authorize a healthcare practitioner at a school-based health center to provide services through telehealth consistent with specified provisions of the Health Occupations article. The bill prohibits MSDE and MDH from requiring an approved school-based health center from submitting an application or seeking approval to provide telehealth services, or establishing requirements for school-based health centers to provide telehealth that are inconsistent with specified current law. There are no amendments proposed.
Okay, thank you. I'm gonna give all of the different advocates who are here just a minute or two to speak to the bill, and then I'll go to Delegate Rosenberg to speak to it. So I'm going to go in the order of folks on my screen. So we'll start with Robin Elliott. Robin, want to tell us why we need this bill, and if you have any questions or information about it.
Sure. So I'm here representing the Maryland Assembly on school-based healthcare. that we know of, I just want to let you know that there are only 18 of the 86 school-based health centers that exist that have been approved for telehealth, which means during the pandemic, most of those other school-based health centers are shut down. We did our own survey and we have identified that there are 13 school-based health centers that applied in November to do telehealth. They are still waiting for approval. There are 4 in Prince George's County that did not apply because the application process, they're still trying to figure it out. It's very confusing. We heard the same feedback from 13 school-based health centers in Baltimore County, and then 2 in Wycomico County asked MSDE to waive the process during COVID, and they were turned down. Those school-based health centers are now shut down. So this is very much about COVID, but it's also beyond, because as the committee knows, telehealth has so many important applications for ensuring continuity of care. Thank you.
Thank you. I'm going to go to Samantha Oroso.
Hi there. Yes, Sam Oraz. I'm an intern for the Maryland Rural Health Association. And in our exhaustive rural health research that we published in the form of the Maryland Rural Health Plan, we found out that school-based health centers are the main point for many students in rural communities. And during the COVID-19 pandemic, the telehealth piece is more important than ever. School-based health centers are also a way to bridge gaps in accessible and quality healthcare in rural Maryland. And again, especially during the COVID-19 pandemic, it is important to offer the flexibility to deliver these telehealth services in non-clinic settings.
Great, thank you.
Thank you.
Pam Casemeyer.
Hi, not to duplicate what you've already heard from both Samantha and Robin, but I'm here on behalf of both the Maryland chapter of the American Academy of Pediatrics and the Maryland Association of Community Health Centers. Some of the community health centers operate school-based health centers, and the Academy of Pediatrics is a strong proponent of school-based health centers. And we echo what you've heard from Robin and Samantha. This bill really ensures that we have a much more definitive structure for ensuring that the telehealth component of school-based health center operations allows them to operate effectively and efficiently, not only during COVID, but moving forward. They have proven to be a very, very effective component part of access to healthcare and ongoing healthcare management for students.
Thank you. Dr. Joy Swege, and you're going to have to help me with the last name. I'll remember it next time.
Twessagy.
Twessagy. Okay.
Twessagy, yes. So, we at school-based health centers primarily serve vulnerable students, homeless students who are underinsured or just don't have a medical home for a variety of reasons. And we want to be able to have continuity of care. We're really invested in the care that we're providing these students, whether it's asthma management, obesity management, diabetes management, and these things need to continue whether there's COVID or not. And so we want to be able to continue those services. Additionally, telemedicine is already happening in schools, especially with behavioral health. So so if we provide behavioral health in a school-based health center, we have not been able to provide the continuity of care. But if students have received behavioral health services through a community-based partner, they have been able to receive their services without any break in care throughout the pandemic.
Thank you. John Willems.
Good morning, everyone. John Willems, representing the Maryland Association of Boards of Education, in strong support of House Bill 34 for all the reasons that you've heard. Would just emphasize that it's not all that common that we come to Annapolis and support a legislative solution to something that could have or should have been worked out administratively. but those exceptions do arise, and this is certainly one of them. And in this instance, legislation is urgently needed to address the unfortunate challenge of having to remove this barrier so that telehealth can become a ubiquitous part of the scope of services provided by school-based health centers. So we, again, strongly support this bill.
Thank you. Thank you. I see that there are questions, but I'm going to give Delegate Rosenberg a minute before I go to questions. Delegate?
Thank you, Madam Chair, and thanks to the members of the subcommittee. As the others have said before me, this bill would require that school-based health centers be treated like other healthcare providers with regard to the provision of telehealth services for those services, those health services that they provide to their patients, in this instance, school children. So I would urge favorable report.
Thank you, Delegate. Delegate Kipke, saw your hand first.
Madam Chairman, of course, I like the concept, but I was reading the testimony and I have 3 issues that I want to bring up. First, Maryland, so there is bad telehealth. Sometimes it's not as good as being in person. I think we all need to acknowledge that. Maryland, on the other hand, it's also fantastic as well for many things. But Maryland Department of Health's letter brings up that there's a checklist that providers have to fill out, and this would eliminate that checklist. And they seem to say it might jeopardize the quality of the care that's being delivered. That's one. So I'm concerned about that. And then 2, there's I don't know about this issue. There's some kind of federal Medicaid regulations that requires the care to be in person. I have a feeling maybe that'll change with everything we've gone through, but I'm a little less concerned about that. But that's another issue that was brought up. And third, there's sort of this, I'm having trouble understanding it, but there's testimony from Maryland Right to Life as it relates to abortion. And if somebody could explain, maybe Robin, I don't know, but what would be different? What is it? What abortion and school-based health centers today versus abortion and school-based health centers if this bill were to pass? If you could help me understand those 2 things. That kind of came at me as a little bit of a surprise to read all that, but I would like to understand it. So I don't know, Madam Chair, what's the appropriate way to go? The first one is the quality of care checklist, and that last issue.
So I'm going to take your questions in order, Delegate. And I'm wondering if Dr. Joy would be able to talk to us about how would telehealth, how could the quality of telehealth care be changed with telehealth in school-based health centers?
Right. So I just want clarifying point. I'm a nurse practitioner, but so part of what we are asking for is that in the last session, the Maryland General Assembly established broad and consistent regulatory framework for the use of telehealth by licensed healthcare practitioners. So there's already laws that address the quality, address who is responsible for what, address all of these things about telehealth. And for some unknown reason, school-based health centers were left out of that. But there's already regulation that covers telehealth, that covers all of that. And so in terms of the checklist, I mean, we feel like that's already been covered by what's already on the regs.
Does that, Delegate Kipke, is that, do you have a follow-up to that, or?
Just as anybody, could we see that? Could we look at it? Could we do it side by side to make sure that whatever, I mean, unless they're just ridiculous claims from the Department of Health. I mean, they say as a result, the quality of care delivered to Maryland's children may be compromised. That's very strong language that none of us would want to see happen.
Right.
I think we should probably look at that more closely.
Look at.
Well, they say that this bill will get them around the checklist. Well, does the checklist, is it not covered by any of the regs that the good nurse practitioner just mentioned. You know, I don't know. I don't know if
I
anybody.
mean, so the checklist is basically saying, you know, does your camera work? Is your internet sufficient? Is it HIPAA compliant? Like that's what the checklist is saying. And
which is
And all
covered
of
in the
that's-
regulations.
right.
And all of that is covered.
Right.
Yes.
That's what we did, and that's when we passed the telehealth bill last session. That's what it did. It defined what you needed to have in order to be to deliver telehealth. And the Medicaid question is, and I'll look to others if they have more information on this. Medicaid changed its requirements around location in order to be able to do telehealth during the pandemic. So we could have had those services available to the students who had school-based health centers in their schools this year. Is there anybody else who wants to speak to the Medicaid issue?
Delegate Rosenberg, would you like me to provide some information to the subcommittee?
Certainly.
Okay.
Great. And I'll also just close the last question with Delegate Kipke. So Delegate Kipke, you asked a very good question. The Department of Health and MSDE would still have oversight authority over school-based health centers. The only difference here is that school-based health centers wouldn't have to wait. They fill out this checklist, and what we've seen is that it takes at least 2 months under good circumstances to get approved. So we're removing the checklist process, but if there are any questions or problems at all, or the agencies just want to see good telehealth, they can interact with the school-based health center at any time to look at that. On the Medicaid issues specifically, what we are looking at post-pandemic is that school-based health center. So right now, it's reimbursed if the provider is at home or at the school-based health center, and if the child is at home. That's through the waivers. What we're looking at post-pandemic is that the student could be at home, that's the telehealth piece, but the provider may have to be within the school-based health center. So Dr. Joy wouldn't be at home right now. Post-pandemic, she'd be at work. So that's really the only difference. So we know that going forward, telehealth is going to be a reimbursable service within school-based health centers.
And do you want to address the other question about whether or not there are reproductive health discussions that are relevant to this issue?
Yes. So school-based health centers, when they do telehealth, can only provide the same set of services that they provide in their physical location. School-based health centers do not provide any pregnancy-related services. In the school-based health center guidelines from MSDE, there's a grid. That grid says that prenatal services or any other type of reproductive health services must be referred out. They are not provided on site. So nothing about this bill changes the status of abortion provision in school-based health centers. It's not done here in Maryland or in anywhere else in the country.
Okay. Delegate Kipke, any follow-ups?
In their testimony, it says once FDA restrictions are removed, the remote. I don't know. Did you read this over, Robin?
I did. So right now, and this is a bigger issue than school-based health centers, but right now, it's not really possible to provide medical abortions through telehealth because the FDA has rules that the medication used must be dispensed in office by the provider. So it happens at the clinical site. There's a question of whether or not those requirements are going to be changed. And there's certainly a lot of discussion around it. However, I don't think that changes the school-based health center footprint. They do primary care, behavioral health, and dental care. And whether it's abortion care or prenatal care, all of that falls outside of the primary care framework. And it is not sort of in the works at all that school-based health centers are going to consider doing abortion services.
So just to put a finer point on it, even if the FDA were to change, which we don't know that that's going to happen or not, there would still have to be, as in current practice, the referral that that currently exists.
Right. And the provision of what is allowed in a school-based health center, the services overall are determined by MSDE. And then the local school district has to agree to whatever services are offered. So within that range, this is not a question that we foresee coming up.
Is that in regs? Where can I find in writing what school-based health centers are allowed to do?
It's in the MSDE school-based health center guidelines, and I'm happy I can do a cut and paste and put that particular page in the chat.
Thank you. Thank you, Madam Chairman.
Could you also send it to the members?
Yeah, send it to the members.
Or whatever's appropriate, Madam Chair. I'm sorry.
No, that's fine. Delegate Saab.
Thank you, Madam Chairman. So I have, I guess, quick question. So when they do telehealth, do they have prescription authority?
Yes. Yes, the scope of practice stays the same.
Right.
So what would stop them from prescribing, abortion medication?
Because we can't do it because of the FDA regulations. We wouldn't be able to do that.
But once the FDA restriction are removed, will they be able to do it?
The likelihood, as Robin said, MSDE would have to agree that is something that school-based health centers would do, and then superintendents would have to agree at the local level that is something that they would allow in a school-based health center in their jurisdiction. And that is just not, I have worked at the national office for school-based health centers, and that is just not an avenue that any school-based health center is trying to go down.
I understand they're not trying to go down, but it's also, it could depend on the nurse practitioner or the provider's philosophy. I mean, they have authority.
No, because there are a set of practices that you do in a school-based health center. So and so if it falls out of that, then you cannot do that. So for example, let's just say for some reason your school-based health center doesn't provide sports physicals. Then at your school-based health center, you submitted the list of services that your school-based health center provides to the state agencies. They have approved it. If you do something outside of that realm, then you risk the shutdown of the school-based health center, or at least the termination of the provider who went out of bounds.
Right, but we're not comparing apples to apples when it comes to physicals versus if a child comes in and say, I want to have an abortion, and those calls are HIPAA protected. Mm-hmm. So it's only between the two people. The parents might not even know about this phone call. So what happens if you as a nurse practitioner, if a child comes in and you're in the system, I say, I want to have an abortion, what would you do?
You would have to refer that you would provide counseling, right? So there's all of your options counseling, and you would refer the child out. And the options counseling includes carrying the child to term, includes adoption, it includes all of the scope, and you refer the child out. There's nothing that we can do other than that.
There's no guarantee that that's going to get done that way because of the protection of having one-on-one with a HIPAA protected communication without the parents even knowing about this. Am I right?
No, because as a provider, you cannot provide services. If you were in a particular practice, you cannot provide services outside of what that practice allows. Even if it is within the scope of your practice, you cannot do that because where you are practicing does not allow it.
School-based health centers, the services that they are able to deliver are defined by the local and state agencies, not by the practitioner. So the practitioner would risk losing their license if they did something outside of the permission of the local agency or the state agency. They could not do it, whether it's one-on-one or whatever, they could not do it. Any other questions? Is there anyone who would like to, any other discussion on the bill? Do I have a motion on the bill?
I can move the bill.
Oh, Delegate Kelly moves the bill. Do I have a second?
Second?
I'll second.
A second. Okay, so I see Delegate Saab. I'm going to ask for discussion. Delegate Saab?
So actually, I was trying to get before the second. Is there a way to hold the bill to see, to just make sure that, because I haven't been able to read what, if Robin shared anything yet, I'm just not ready to vote on the bill yet.
You can ask, I am happy to hold the bill. Is there objection to holding the bill? Okay, then we'll take the bill up next Tuesday for sure.
Thank you. Thank you,
Okay.
Madam Chair.
All right. All right, well, I want to thank all of you. Thank all of you for being here. Delegate Rosenberg, thank you. You had a, you get to go back to your subcommittee now.
Yes, ma'am.
I want to
you.
thank those who are watching. If you have questions about the action of the subcommittee, please feel free to contact us, and everybody have a great afternoon. The subcommittee is adjourned.
Great job, Madam Chair.
Thank you.
Thank you so much.